Assalamu alaikum. This is Dr. Erum from CODEM. As per CODEM's commitment, today we are here again with one of our prestigious part of CODEM, Dr. Zishan Sheikh. He is also a graduate of Bagai Medical University from 2004. Assalamu alaikum, Dr. Zishan.
Assalamu alaikum. Thank you for having me.
Thank you very much for being on board and giving us time. Dr. Zishan is basically, he is a dental clinician and a biomaterial scientist with clinical and research degrees of BDS, MSc and PhD in dentistry. Dr. Zishan moved to Canada as a permanent resident in June 2010 and continued his training and his PhD from McGill University, Faculty of Dentistry in 2014. After his PhD, he then moved to Toronto and obtained 2 fellowships at Faculty of Dentistry, University of Toronto from 2015 to 2017 and from 2017 to 2018. After that, he's currently studying in Dalhousie University. You're doing the residency, Dr. Zishan, right? A 3-year program in pedontology and implant surgery. Dr. Zishan has helped many students and many people from dental fraternity to design up and to align their career in dentistry, reaching Canada, US, and other places. I would like to ask Dr. Zishan today that he should just briefly tell us that how he could help our community, and if our participants would now want to get any advice on how to develop their career and explore various dental or alternative research or academic related career options in Canada and US, you can contact CODEM to know more details regarding one-to-one career counseling sessions with Dr. Zishan. The mic is over to you, Dr. Zishan, now.
Thank you, Dr. Erum. First of all, the participants' mics need to be turned off. Otherwise, there's no point doing this webinar.
Yes.
Nobody will be able to hear us.
I would like all the participants, I would request all the participants to please mute their mics. Thank you very much for your cooperation. Asma, someone is Asma, please turn off your mic.
Told me they were asking about my previous year about it, where it was and such. They're still, they know about the factor. Everything. 14, let it slip. What did you say? Well, what does that count? The truth. Okay. But they say, why did you?
Asma, please, all those whose mics are on, I'm just trying to give a last reminder. Please turn off your mics. Otherwise, unfortunately, I would have to end their sessions. Yes, Dr. Zishan.
I'm just waiting for everyone's mics to be turned off. I think it should be done from the host side.
Yes.
You don't have to request the people to turn it off as a host.
Yes, it's done. It's done.
The host should be doing it.
Yeah.
I still see at least one more person with his mic on, so I'm going to start. Okay, I'm going to share my screen, and then once I do the presentation, we can have a quick discussion if time permits.
Sure.
Dr. Erum, are you the host, or do you have somebody who's acting as a host for you?
Yeah, we have a host. We have that panel.
Can you instruct them to make sure that they're constantly turning the mics off?
Yes, sure.
Can you do it right now before I share the screen?
Yeah, sure. Zia, please turn off all the mics.
And keep looking tell them to keep checking, right? That's the purpose of the host.
Yes. Yes, just keep looking, or just keep the mics of Dr. Zishan and me open, and then rest, keep all the mics mute. Thank you very much. Yes, we are clear. Yes, Dr. Zishan, you can start now.
Okay. So please let me know if you can see my screen, Dr. Erum.
Yes, I can see your screen very well, very clear.
Okay, so it's in full mode screen now. Okay, full screen mode.
Yes, sure.
Okay, so we're going to quickly talk about some career paths and options available for dental graduates and foreign trained dentists in Canada.
Yes.
Firstly, I'm going to disclose that there is no conflict of interest and I have no fundings to disclose. So basically, we are going to cut this webinar short, unfortunately, because we had some technical difficulties. So we don't have the whole session in terms of time available. So we're going to be kind of rushing through because I have another meeting to go to. But we'll quickly talk about why Canada, what do you do here, how do you do it, and why do you do it, right? So we'll try and summarize all of this, and then if Dr. Erum has a few questions, I can try answering.
Thank
So the
you.
first question is why Canada? Why do you want to come to Canada? Now, in terms of that question, that is something you need to decide between you and your family, if you have a family, that why are you coming to Canada? So if you're coming to Canada based on the reason that you are coming in as an immigrant and this is going to be your adopted home, and if you're a dentist or any student who is related to the field of dentistry, you need to start thinking about all the steps you have to take, not only before, but the steps you need to take right after you land here, because time kind of has this uncanny way of passing really quickly. And before you know it, it's a year, it's 2 years, and you need to have a kind of a focused approach. And that's something I help with people. Dr. Erum, you need to tell the host to get these squiggle lines on the screen removed as well.
Okay.
Okay, so that is something which I help people with in terms of the one-on-one career counseling sessions, where I look at their profiles and then individually in about an hour or so, give them kind of a roadmap or a plan as to what are the things you need to do before coming here, what are the things you need to do as soon as you get here, and what is the best options in terms of the high percentage of you getting employed and actually making a living. So that is something which is important. So in terms of the career options there are for general dentists in Canada, you will see that this kind of gives you an explanation of, if you're a general dentist, you could either do a specialization with an MSc or a PhD, you could do an MSc by research, you could then do a PhD, or you can do it directly a PhD if you have a master's from somewhere else like I had from England. And then based on these, you can then either do clinical practice, you can do research, you can be in academia, you can be industry, or you can combine a combination of all of these. Also related to this field are the fields of dental hygiene and dental assisting, which a lot of people opt for when they come to Canada, not only as a stopgap arrangement to get into the system, but to start being employed and making some money. So we'll talk about what are the pros and cons of doing all of these. And then if there are any questions from Dr. Erum, I can try and answer briefly as much as possible. So the first thing is, as a foreign trained dentist, how can you obtain a Canadian general dentistry license? That is the most common question we get, right? So there are two options. One is either you go through the advanced standing programs to obtain a DDS, which means you will have to repeat, it's 2 years, but it's actually now 3 physical years of doing it. And then the other option is having giving the exams and challenge the equivalency process and getting the direct license. And all this information is available at the NDEB website. So it's not a bad idea, or it's a good start for you to go to this website and start looking at the options. Now, if you go to, and I'm providing you links with all the links for all the websites which might be useful. If you go through the Association of Canadian Faculties of Dentistry website, you will again see a lot of detailed information to get you oriented in terms of, if you are a graduate of an international non-accredited dental program, which every program is in Pakistan, or some other countries as well, this will give you an information or a good starting point as to how to start getting into the process of obtaining a license. Again, the other website you might want to be looking at is the National Dental Examining Board of Canada website. And again, based on your level of expertise and your training in which country, you can actually go through these resources and materials, and this will give you enough information that you need to start off. Another website which is really good is the Commission of Dental Accreditation of Canada. And the reason I like this website is you can actually, Dr. Erum, can you see my cursor when I move it?
Yes.
Okay, I'm going to try and, do you see the laser pointer?
Yes.
Okay, perfect. So what you can do is you can search by province or program category on this website, which means you can choose which program you're interested in, and you click on it, and then you search by program, and it will give you the options for which programs are available in which countries, in which provinces. Now, in a nutshell, this is how it works. If you are somebody from a non-accredited dental program and you're a dentist, what you can do is you can go through the NDEB equivalency process, which means you're going to take the Assessment of Fundamental Knowledge exam, which is known as the AFK, and then you have the option of giving the Assessment of Clinical Judgment and the Assessment of Clinical Skills exams, which are two separate exams. Once you clear that, you give the NDB written exam and OSCE, which even people, for example, from the States who would come to Canada would be going through, and then you get the NDB certification, and then the provincial licensure. However, after giving the AFK, if you don't want to go through the direct license, enough score, you can apply through the qualifying degree programs, get into a DDS program, complete the last 2 years, which now in most schools ends up being 3 years, and then you again get to this point. So these are the two major routes for you becoming a licensed general dental practitioner. One is through the university, and the other one is directly. The direct route has its pros and cons. The pros are that arguably you could do it in a year if you're really lucky and you're smart enough. It would be less expensive than going through a dental program. However, the problem is if you've never practiced in North America, if you get a license today and you walk into a clinic tomorrow, you might not be ready to actually start working, because getting a license is one thing, actually working is another. So in my opinion, getting the DDS is always a good option because it trains you over the period of 2 to 3 years to actually enter the dental workforce. Now, again, this webinar is probably going to be saved and it's being recorded, so it's going to be online. So I have provided you with the completion program contacts for Alberta, Manitoba, and Ontario. I can assure you that the child crying is not from my side. Somebody needs to be muted. Quebec, 2 schools, McGill University and Université de Montréal. And that school is in French, so if you don't know French, that is probably not for you. And then Nova Scotia, which has Dalhousie. So again, you can go through this website or you can contact the schools directly to get more information. Now, this is the average salary, which a dentist kind of makes. And when I say average, obviously it has a high and a low. So there are people who don't work that much and they'll be making a lot less than 100,000. And there are people who would be working 6 days a week. Depending where you're practicing, what kind of practice and what city, you could make up to, more. So obviously this is just an average, but it is not a number I'm quoting. This is actually a latest number. So an average dentist is going to make about 131,000 per year. Now, in Canada, you've got to keep in mind that we do pay a lot of taxes. So the higher you go, the more taxes you pay. So if you make more than $220,000, you can be paying up to about 50% tax. So that is something you need to keep in mind. Apart from being a general dentist and getting the license directly or going through schools, you have the options of going through a clinical specialty program, which is usually known as a clinical specialty residency, which is combined with an MSc, and in some schools and some programs, also with a PhD, which is longer. So usually the clinical specialty residency with an MSc is about 3 years. If you do it with a PhD, it could be up to 5 to 7 years, depending how quickly you finish your PhD. Now, you can do this clinical specialty program with an MSc or a PhD in any of the 9 recognized specialties in Canada. Dental public health is considered a specialty, so doing a residency allows you to sit for the Royal College exam, and it doesn't allow you to practice on people, but it gives you access to humans for your field. You have endodontics, maxillofacial surgery, oral medicine pathology, oral maxillofacial radiology, orthodontics, pediatrics, perio, and prost. Now, you have to keep in mind that these programs are offered in different universities across Canada, which are about 10 dental schools, but not all schools offer all these programs, okay? Upon you successfully finishing your residency and graduating, you are allowed to sit for the NDSC exam and obtain a specialist license to practice in that specialty. And then there's a fellowship exam from this year, which is optional, which is a kind of a it's not need to practice, but it's a title. It's an honor. It's you clearing the fellowship makes you a fellow. So you can choose not to take it, but mostly people who are in academia choose to take it. Now, you have to keep in mind that these programs, you do not need to have a DDS or, for most of these programs, a Canadian license to apply or to get in. However, these are super competitive. So for somebody who is applying from outside or has just come to Canada and applies to this directly, the chances of getting even an interview are quite rare, let alone getting in. So there are other routes which you need to take to actually get to this point. So again, this website is great for looking at the information regarding all of these specialties, what do they entail, and once upon completion, how and what you can do after you get licensed. Again, the CDAC website is great because you can choose the program and you can choose which program you're interested in, and it will give you all the options for the various universities which offer those programs. So, for example, if you search for oral maxillofacial surgery, you will see that these are the 6 universities in Canada which offer a residency and a training program in oral and maxillofacial surgery. And then you can click on these individually to look at the eligibility criteria and other stuff. So if, just to correct myself, I said that for most schools, you do not need to have an active dental license in Canada or a DDS. There are exceptions. So for example, at the Schulich School of Dentistry, which is at University of Western Ontario, if you want to do your residency in orthodontics, you cannot apply if you don't hold a Canadian NDB license or from US. So again, if you look at periodontics, you can see they're offered in these 6 programs. 5 of these are in English. One of them is in French. So again, you can have a look at, so this website is great for you to start looking at the specialty you're interested in, going through all the schools, which cities they are in, what are the eligibility criteria, what are the deadlines for application, what is the interview process, how much it costs. All that information is there. You do not need to ask anyone. You do not need to search from third-party resources. It's just a matter of putting in enough time and you'll get all the information. And again, through this, you can get the information for contacting directly. For example, if you look at Dalhousie, you'll get the information for the website, and it will tell you what 4 specialties this school offers you in terms of being a specialist. Now, again, this is an average, but I took this out recently from Salary Expert, and you can see if you're a licensed periodontist, and if you're starting newly, 1 to 3 years of experience, you can make up to, on average, about $211,000, which is a really good amount to make. And the entry level you can see is at much more than the average for a general dentist. The average is 211, and if you have enough experience, expertise, and you're doing a lot of surgeries and soft tissue surgeries and implants, you can make up to 271, but I do know people who make a lot more than this as well. So that is the specialties and the dental license. Now, let's talk quickly about some MPH and DPH programs, so Masters in Public Health and Dental Public Health programs. So there was a survey in which people who were in these fields said that they were earning between 60 to 80,000 per annum. And the mean average for Masters in Public Health graduates, if they get employed, which is the important point, is about 73,000. So it's a reasonable amount of money in Canada, not too much, but luckily the way the system works is if you're living in an expensive city like Toronto or Vancouver, this might not be much, but if you're living in a cheaper city, yeah, you could be living comfortably off it. Again, you go through this website and you see all the educational programs in public health, which are available in Canada. It allows you to see how to plan your career in public health, how do you train in the health profession, and what are the degrees available. And so, for example, if you go through the mastersportal.com and you search public health, you'll see that University of Waterloo has an online program. Then there's a full-time program at the Simon Fraser University in Burnaby, Canada. Then there's a program in epidemiology at McGill University, and also at University of British Columbia. And the good thing is you can change this to Canadian dollars or US dollars to have a comparison to in terms of what is the tuition you can expect to pay for these programs, how long these programs are, so you can start understanding how to kind of financially also manage your educational career. Some of the jobs that you can expect to do with your MPH degree are in public health management. You could be a director of programs and services and work with health communications specialist people, and you can be a research scientist, you could be a manager. So you could arguably get quite a few jobs based on this, but again, this is not my field, so I can't really dwell too much. But if I do some a career counseling for somebody one-on-one, then I do guide them to the right people and resources for them to actually get more information. If you are a public health dentist in Canada, the average salary is about $165,000, which is great. Again, the problem is that these positions and these opportunities are very few. So there are more people who graduate who actually get to this position. So you need to be very mindful that Canada is a large country with a small population of only about 35 million or so, which is probably slightly more than what Karachi's population is. So the opportunities are not as much in these fields than in the States, for example. Again, there's another website such as the schoolfinder.com, which again, if you search by keywords such as dental public health, it will allow you to go directly to all the schools and the programs which are being offered. Now, again, just like the Masters in Public Health, after doing your degree in dental public health, you would be working in the field of public health, but relating to oral health and dentistry. And again, if that is something you are interested in, you can definitely go for that. And there are quite a few people I know who have gone through that and have successful careers right now. Then we switch gears and we come to MSc and PhD research-based programs. So these are MSc and PhD degrees, but purely by research. So it does not have a clinical component. And if you do have a clinical component, it's probably in line with doing the clinical trials for your research. So you're not really getting trained as a clinician through these. These programs are pretty much offered across all dental universities across Canada. The trick is that getting a PhD or just a master's means nothing. You need to have a good, productive postdoc. And by a productive postdoc, I mean having several publications and grants before you're even eligible to be considered for a faculty position. And that is the problem, because the number of PhDs is increasing dramatically. And the problem is that only 18% or so get employed as full-time university professors, and even a smaller number actually hold tenure track positions. So this is not a path in which you just go through the motions, you get the degree, and you think or you feel that you're going to get employed. It's going to be really difficult. Plus, after doing your MSc or your PhD, the other options you have, if you don't become a professor, are to become a research assistant, you can become a research associate, you can become a professor or researcher, and you can also contemplate a career in industry and research and development. Dental assisting, that is an option which a lot of people choose when they initially move to Canada. What they do is they go through the program, and then they start working in the time they are preparing for the license exams or getting into schools. My personal opinion is dental hygiene and dental assisting should not be used as a stepping stone. And that's my personal opinion. And the reason for that is the time and the effort and the money you will invest in becoming a dental hygienist or an assistant, that time and when you start working could be used much wisely towards you getting into a dental degree program, getting your license, or getting into a specialty. So I personally feel that, and again, this is anecdotal, but I know several people who tried to do things through this route. It may work for you, but more often than not, you get stuck at a certain point and you've kind of wasted your time. So unless you're really interested in being a dental assistant or a dental hygienist, you should stay a little wary of these options. Again, I have provided you with this website, which allows you to get all the information you might need for becoming not only a dental assistant, but also information relating to the Association for Dental Assistants in Canada. The NDAEB is another thing. If you are looking to actually go into the field of dental assisting, be very closely monitoring this website, looking at the rules and regulations, because once you do the exam, once you finish the training, you do have to give the exam to become certified. Again, the same CDAC website will also give you the options for all the dental assisting programs and dental hygiene programs. And obviously, after this, you can work in these sectors as a dental assistant. Now, again, when we talk about dental hygiene, this is the average salary which has been quoted. You're going to work as a hygienist in either a general practice or a specialist practice. This is a great website, again, for dental hygiene, the Canadian Dental Hygienists Association website. You can get all the information there. There are some degree and degree completion options at Alberta, University of British Columbia, Manitoba, and at Dalhousie. These are really good programs for dental hygiene. Again, if you're somebody who's genuinely interested in dental hygiene, go through this. I would suggest not using this. Again, this is my personal opinion based on my experience in Canada in 11 years. I would not be recommending anyone using this as a stepping stone to get into dentistry or into a specialty. Again, these are some of the diploma options in dental hygiene only in Ontario. So you can see there are quite a few institutions. And again, the CDAC website also provides you with all this information. Now, I'm going to, after doing this, I'm just going to take you very briefly through how my career has kind of progressed. And I'm not doing this to advertise myself or to boast. I'm just showing that how what I have managed to do in my short career fits into the kind of the rubric of the Canadian dental system. So I graduated as a BDS from Buckeye Dental College.
No, I think it's we should start, and the people are coming. We're sending the links to the participants. So
okay, just ensure that when people come in, their videos and their audios are off. Okay?
Yeah, it's just like that. With the moment they log in, we just have to make
okay.
sure.
Yeah.
Let's start.
Okay. Is this being streamed live on Facebook as well?
Yeah, it will be streamlined once. We are just recording it now, and then we'll streamline it afterwards.
Okay. So that's not live. That's a
No,
recording.
no, that's a recording.
Okay. Perfect. So I was telling about the fact that I did my FCPS Part 1. However, what I did is I went to England and I did my MSc in dental biomaterials. And my work was related to resorbable polymeric membranes for guided tissue regeneration in perio. And that was my beginning of my passion and love for perio. So when I got back, unfortunately, FCPS and operatives did not seem to be the right option for me. Now, this is another thing I would like to personally give advice. Do not be afraid to change your paths. Nothing is set in stone. Sometimes things happen for no reason. I actually don't believe in the saying that things happen for a reason. Nothing happens for a reason. I could have chosen not to give FCPS Part 1. I could have chosen not to go to England. It wasn't that I was destined to do anything. I could have easily gone into public health to the US. These were all options. You take the options and things either work out or they don't work out. The only thing you can do is just put in a lot of hard work and just leave the rest to destiny, right? So my example, the reason I give this example is after my master's, I could have felt that, okay, I need to do my FCPS training. Why don't I finish this? And then I do my PhD. Could have worked out, but I don't see how an FCPS and operatives would have, thinking back in time now, would have helped me in my career. So I think I, at that point, chose wisely to not do my training. And I worked for a couple of years as a private practitioner with Dr. Altamash. I taught as the head of the Department of Materials and Preclinical Dentistry, and also as an assistant professor in oral anatomy. And then I went to Canada in 2010. I went to McGill. I kind of was lucky because I got my immigration and my PhD admission at the same time. So when I landed, I was already an immigrant in Canada, so I had the residency status. And then I went to McGill, where I had already secured an admission with a complete funding and a salary. And I did my PhD in about 3.5 years, but with the paperwork and the thesis and everything, it was exactly about 4 years because I finished in 2014, August. And then after McGill, I had already secured my postdoctoral fellowship to go to Toronto. So as soon as I finished, I moved to Toronto. I did 2 fellowships at University of Toronto and at Mount Sinai Hospital till 2019. And I worked extensively on vertical bone augmentation, defect bone fillings, drug delivery using graft materials. And it was a very productive postdoc. I was lucky to be in institutions and under mentors, which were very appreciative and encouraging. So I did manage to get about 33 publications and book chapters and stuff during my postdoc. So that was something which I feel was an important part of my career, more than even my PhD, because postdoc is where you start realizing how to do real research. You're more independent, you are supervising people, you're running projects, and you're writing grants. And that is the important thing. PhD for me is just a starting step. The real game starts when you finish your PhD. After that, I started my perio specialty in 2019. Currently, I'm in year 2 of my training. It's a 3-year program. Once I finish, my plan is to be in academia and research, to maybe 2 or 3 days of private practice. So it's going to be a kind of a balance between academia, research, and hopefully some clinics. And I always remain in touch with industry. So I did a lot of internships in industry with Medtronic in McGill, and then I did another Mitax Accelerate with Mesentech when I was in Toronto, and now I do work as a biomaterials and a surgical consultant for Mesentech Inc., which is a Canadian biotech company out of British Columbia. So the reason I told you about my path is I wanted to show you that either by chance, luck, it was definitely not by design, that my career has allowed me to now be in touch with all 4 of these: clinical practice as a specialist, research, academia, and industry. And I feel that for me, it's important not to box myself in just one career sort of an option or a box, because that for me is mundane. I like to have some intellectual stimulation, which does not get provided by clinical practice. This only gives you money and some satisfaction. All the intellectual fulfillment you get is going to come from research, academia, and industry. And I completely agree that these are not for everyone and they shouldn't be. So do not get into these streams if you don't have the passion or you're not willing to put in 5, 6, 7, 8 years of hard work with no guarantees, to be honest. And you know, Dr. Erum, going through a PhD, that projects can work and they cannot work. So
Exactly.
there's no guarantees.
We have a famous phrase: no result is a result.
Absolutely. Yeah, absolutely. So the only reason I kind of gave my career in a nutshell is to kind of show that I feel lucky that I have these all four different facets. So even under COVID lockdown, I was not sitting at home not doing anything. The clinics had shut down. I used all that time for my research, online teaching, webinars, and industrial work and consultancy. So it not only allows you to be more fulfilled, but it gives you multiple sources of income, which is really important, I feel. Anyways, so if somebody wants to look at my research profile or my work, you can go to Google Scholar, and what you can do is just search my name and you'll come across my profile, which will allow you to look at my publications and my co-authors and what kind of work I do. So if anyone is interested in sort of a similar sort of a career or similar areas of expertise in terms of research, you might be able to get some information regarding what sort of projects I have been part of and published. There are also some resources and courses to prepare for general dentistry licensure and other programs. So I had this group, which I made about 10 years ago, and now it has 42,000 members. And I regularly post opportunities, things related to dentistry, career-wise, and other information. So if anyone wants to join this group, they are more than welcome to do so. I do have a professional page as well, where again, I do post regularly, not only opportunities, but things related to dental research, education, and also interesting news. And I obviously am on LinkedIn as well, which you can probably see over here. So feel free to connect with me through either my professional page or my LinkedIn. And if there's anyone who wants to get more information or more an in-depth one-on-one sort of a session, you can contact CodeM and they can line up those sessions for you. I'm going to end this by giving you a kind of not advice, but more things I feel are very important, not only for Canada, but for anything you want to do anywhere in the world, and regardless of what field you're in. So it's important to invest into your future, not just money, but build your expertise. So by developing new skills and improving yourself to make yourself more competitive, you are investing in yourself, because remember, the most valuable commodity you have is not your bank account, is right up here. In my opinion, this is the thing which, if everything gets taken away from you, one thing which cannot get taken away from you is education. So you could be zero, and if you have education, you can actually get on your path again and build something out of it. If you have a lot of money, but you don't have the skills, you don't have any expertise, and if the money goes away, good luck. So it's important also, I feel, to improve your linguistic skills. I personally know for a fact that nobody gets judged during an interview for a DDS or any other program based on their accents. A lot of people think that having an accent equates to having good linguistic skills. That is not true. What you need to be is a good communicator, be able to get your ideas across, and that kind of builds up into your personality. Our personalities are how we are. However, it is important for us to remember to be humble, be likable, and I know that's hard to do. We are who we are. If you don't like me, you don't like me. And that's my problem, not your problem. But there is a fine line between being confident and showing through your behavior that you know what you're talking about. But there is a fine line, and once you cross that, you become obnoxiously overconfident. And unfortunately, we have seen enough people who, after having maybe 1, 2, 3 degrees, feel that they know everything. That is not the case. This is a lifelong learning. The moment you think that you have stopped learning is where you're going to actually stagnate, or even worse, you're going to have your downfall. So it's important to maintain your sense of humbleness, invest in yourself, make sure that you improve your skills. If you can do shadowing or observerships, those are great opportunities to learn how private practice works. And I don't just mean in Canada, otherwise as well. Start getting into the habit of doing community service. This is something which is really appreciated when you apply for programs in Canada, especially, and North America, where the ability to give back to the community. So joining an NGO or a blood bank or a blood collection service. Try and do as many continuing dental education webinars and courses online. However, be mindful that anyone who has an internet and a computer right now is providing you with information which may be true or not true. So be very careful what you read and listen on the internet, because unfortunately everyone can do it. Do not throw away your money on courses which you feel are just going to be on your CV, but not making you learn. So thoroughly investigate who's giving you the course, how much they're charging, what is their background? Do they even know something which they can teach you, or they're going to teach you something wrong? Start volunteering, get some research experience if you can, and all of these things will really help you once you get to Canada, and then you can continue doing all of these, on the side when you're preparing for your license and stuff. With that, I'm going to thank you. Remember, it's all a combination of good planning, hard work, persistence, and determination. You can be the hardest working person and can be very persistent and does not know when to quit. But if you're working in the wrong direction, it's useless. And if you haven't planned enough, it's useless as well. So I honestly believe 95% is planning and 5% is execution. And in my opinion, that is what constitutes as success. And success should not be measured by how much money you make, but it should be measured by how content you are with what you do, how much you give back, and whether it makes you happy or not. So with that, I'm going to unshare my screen, and I'm going to allow Dr. Erum to ask a few questions if she has any.
Yeah, sure. Many of our participants, first of all, thank you very much, Dr. Zishan. It was a wonderful, wonderful explanation. It was, I think, something that is very encouraging, very self-explanatory, and we are delighted to have a lot of participants, mashallah, and many of them, they are still aligning and sending us their questions. I'll not take a lot of your time, but we have some questions from our participants. First of all, I would like to tell all our participants and all of those who are watching it as a recorded session that if any of you wants to have a direct session with Dr. Zishan or regarding career counseling, regarding their their way, if they plan to settle abroad in Canada, in US, or if they have anything like that, they can have direct career counseling session with Dr. Zishan Sheikh, and they can have their we are sharing the screen for the email address, so that you would have an email address to send us your queries, and we'll connect you to Dr. Zishan. Okay, Dr. Zishan? Now coming to the questions. The first question we are having is, what are the basic professional shortcomings Pakistani dental graduates have, due to which they have to work extra miles in their international professional journey? What do you think about this, Dr. Zishan?
Yeah, unfortunately, there's a huge disparity, in my opinion, based on different institutions, which means that the standardization is not there. And it's not only amongst schools, but there's no standardization within the same batch as well. There are going to be, in my personal opinion, when I got into Buckeye, I would be very surprised if I would have even gotten into medicine or dentistry if I was in Canada. And I was considered to be one of the good students. So you can well imagine what happens with the rest 65 or 70.
Very true.
So that is something I feel is lacking, which is standardization. So there should be a certain standard at which all passing graduates as dentists should be at, which in terms is the reason why our programs are non-accredited. And I completely agree with it being completely hard for people who don't deserve to get to become a dentist abroad to not be a dentist or be a clinician or a surgeon. So I have no problems with the exams being hard, we having to jump through various hoops to get through that. Now, the one thing which I would suggest any student to do is don't wait for the schools or your teachers to spoon feed you anything, because that's going to be too late. They're not going to do it. You're going to graduate, you're going to do a house job, and then you'll realize you don't know much either. So be proactive in terms of not only your didactic education. I have never studied from those, I don't even remember the names of those little books people read to pass the exams.
Exams.
I have always read textbooks for every subject, and it has immensely helped me. I have never studied at the end of the term for an exam. I have always studied a little bit from the start till the end, and I am to this day the same. Now, I know everyone's different, but I'm telling you, it's a recipe for disaster if you think that you can study in the last 2 weeks before an exam. You will pass the exam, but this will come back and haunt you when you actually go abroad and you start giving these exams, because that base, which is supposed to be made at that point, you cannot overcome later. You don't have the time, not the energy, not the resources. So be proactive, read on your own. Do not study to clear the exam, study to gain knowledge. Make sure you take all the opportunities you get to improve yourself clinically. Hands-on is a very important aspect. I see a lot of CVs from a lot of people, not just from Pakistan, but other places where on paper, it seems like they have years and years of clinical experience, but unfortunately, we all know that most of those are inflated or over-exaggerated. And when it actually comes to real life, they are probably not as good. So make sure you overcome all of those by being proactive and making most of all the opportunities you get.
Thank you. The next question is, what is the preferred way to settle in Canada, considering age, finances, background, time, etc.? Like student stream, is it like, do you think that the student stream would be a better and faster option for the people, or the immigration programs? What is your suggestion in this regard?
I don't think there's a right or a wrong answer for this. To each his own. If you do not qualify to be a resident in Canada, the only other option is you coming as a student, but you have got to keep in mind, when you come in as an international student, your fee is exorbitantly high. You do not get much, or if any, support from the Canadian government because you're not a Canadian resident. So you're going to have to pay a lot more money. And then if you come in as a resident, yes, this is your home. You do get some support from the government. The fees are a lot less than the international fee. And after that, you automatically have spent enough time to get your passport. Whereas when you come in as a student, you're dependent on finishing your education, then finding a job, then getting the residency, then completing that time period to get your passport. So one shoe does not fit all. Age is not a limiting factor, but with age, sometimes people are moving with families and they have different priorities and commitments. They have children and they can't just sit at home and study for 5 or 6 years. So that's something which is really detrimental for a lot of people's careers, that it's not that they don't want to do it. It's just that life gets into the way. So do not come to Canada thinking that this is a land of opportunities where you're going to come in and everything's going to work out. It's just like any other country. It has its sets of challenges. It is a very fair system, in my opinion, not just in dentistry, but generally in terms of the way you live. But what I do suggest is make an effort to have this move really well planned. know what are your objectives. If your objectives are just to come here and get the passport, you could do that by just staying here and doing odd jobs. But keep in mind, just getting the passport is not going to get you a job anywhere. Like even if you
Mm-hmm.
go, if you think you're going to go to some other country, you've got to upgrade yourself in terms of your skills and your education in order to use that passport. So again, it's
So
and
it all depends on circumstances, definitely. There's,
that's where the one-on-one counseling comes, because
mm,
for each person,
yeah.
it is a tailor-made sort of conversation we need to have.
Yeah, exactly. So anyone who plans to go, so it's better that they should discuss all their circumstances and what exactly they're looking for. So it's better to be discussed in one session, because it depends. It's entirely different for everyone. Fine. The third question is, how can the dental graduates, either the fresh or the old, improve their scores in express entry program? This is also a question from one of our participants.
So for that, again, either you have two options. Either you go online and you look at the immigration process generally, and they tell you if there's a score-based system. You can do a self-calculator, and you know what scores you get. The other option is going to a reputed Canadian immigration firms who do these consultancies in Pakistan. So for example, not to plug any advertisement for anyone, I personally went through Lalani and Associates. I've had really good experience with them since. It's been 10, 11 years. I've had multiple family members go there. They initially were, it did help that the owner and their family were my patients, and we're good friends now. So again, I feel that rather than going round in circles and trying to find answers yourself, I feel in going to experts and not, so there are few things which are facts. The sooner you get to those facts, your time is saved. So I'd rather use my time for things I need to do rather than waste my time on trying to find information which could be readily available to me, even if it means paying a fee. Because you going to a professional for finding these things and having these things laid out for you actually equates to your time being saved, which equates to money then.
Exactly. Because I know it depends when we are filling up the express entry program. There are certain NOCs which are only designed and like you might have the same credentials, but when you apply the NOCs differently, you might score differently. So it's basically for the consultants. But I think I agree with you that it's better that we should consult the professionals who are dealing with these cases and could help us consult it. The next one,
it's funny that suddenly on Zoom somebody's video just comes up and you kind of get scared that why is this person on, but then you realize that it's participants who are joining in.
Okay. And then is it necessary to have a basic research profile with few publications before anyone would like to apply for any course in Canada?
So research definitely helps. However, publishing articles in newspapers and non-index journals and magazines, that's not research. Let's be very clear about it. There's no harm doing that. I do it. I do it all the time in Canadian magazines such as Oral Health, which are not peer-reviewed. They're editorials. I do that to give information to general dentists and other people reading, but that is not considered research. So be mindful that if you try and do that to pass off as research in your profile, people who know research are going to look at your CV and they're going to find out what's there, which is useful or not. So there's no harm, but be mindful of predatory journals where they charge hundreds of dollars to publish your research within a day. And we know what those journals are, and we don't really consider them as reputed articles then. So yes, try and get proper research training as much as you can. I know we are not taught any research during the BDS, which is unfortunate. You don't even know what plagiarism is or what citations are. Go to people or professors who are trained from abroad, and they can maybe take you under their wing and give you some sort of an experience for a few months. That is useful. But the other important thing is to just kind of be mindful of the fact that having research is good, but you need to know what research is and how to show it on your profile.
So this is also one of the agenda of CODEM that with your help, Dr. Zishan, and with our vision, definitely we are going to establish and promote this research culture for our undergraduates, because this is one of the biggest, I think, shortcomings which I have faced personally.
Yeah.
Most of us have faced personally, that once we go out, we feel these terms to, like, we hear them for the first time. It's not about understanding. We hear the terminologies for the first time, and then it takes very long to,
Yeah.
like, to understand and to work on it. So
Yeah,
it
the
is
other
becoming
important thing, I'm sorry for cutting you, but the other important thing you need to keep in mind is how to have a proper professional CV, which is very important, because when you email someone, you have to keep in mind people get 50 emails a day at times from people looking from abroad, looking for opportunities. Your CV is replacing you as a first sort of contact, right? I
sure.
see on Facebook a lot of this kind of obsession with people saying your CV should be one page long, and I don't know where they get it from and what they mean by it. For myself, my name, my affiliations, and my degrees is more than one page. Now, why should your CV be one page? I completely agree with not putting useless information in your CV. Like, nobody needs to know which hospital you were born or who was your mom's gynecologist and what's your outlook in life. But you need to put in at least your academic degrees, work experience, research experience, uh, any any other skills you have, any publications you have, any prizes, awards you've had. Do not try to exaggerate your CV to make it long, but you should not have this obsession that I need to somehow cut it down to a 2 or a 1 page bio sketch. If somebody asks you for a 1 page resume or a bio sketch, that's different. But have your CV. Your CV is your substitute when you're sending it to someone. So if I get a CV and I see typos in it, that's going into the bin immediately, because I can't take that person seriously anyways. So if you if you come in for an interview without brushing your teeth and not brushing your hair and not washing your face, it's the equivalent of your CV having typos and having formatting errors and putting weird fonts and not having standardization amongst bullet points and stuff. Take your CV very seriously, because I do, and I know a lot of people do take their CV seriously.
This is one good point that you have enlightened, and I think that this is very common. I have gone through this thing, and this is one of the important factors that all of us should keep in mind. The next question is, what is the impact of higher IELTS scores while applying for Canada? And is there any better and easy alternative language proficiency test options available rather than IELTS? Because there is generally a phobia about IELTS in the general public in Pakistan.
So based on my personal experience back in the day, I've given IELTS, not only the British, but the Australian, but I've also given the TOEFL. Now, again, for most people, IELTS and TOEFL is not a challenge, but for some it is. Now, having a higher IELTS score than the minimum required does not improve your chances, one, getting into a school, nor getting the immigration. Because if the band score required is 7, even if you get a 99999, that's not something which is going to get you into the dental school, right? You're not getting into a master's or a PhD in linguistics or English literature or something. So the point is, yes, obviously you need to have the bare minimum, which is the requirement. Higher score obviously means that you're more proficient linguistically in that language, which will be a plus point for you. But I have seen people, I've actually had a colleague who came from Iran, and she did her dentistry from Armenia, so she knew Farsi and Russian, but no English. And within 8 months, she had taken courses and she was speaking English, and she got into McGill for her master's. So since we are lucky that our mode of education for most of us in schools in Pakistan is English, we already, but again, that's what I said. We need to improve ourselves not only in our skills and personality, but also linguistically. So improving your language, having a better proficiency in the language obviously helps you to better network and stuff. But the short answer to your question is, having a higher score than the bare minimum is not going to help you directly in the interview process or getting into the admissions.
Okay. Now we are left with the last 9 minutes of our session. We'll just quickly run this. This is like if the DDS program in Canada is accepted in US.
Yes. So once you graduate from an accredited program in Canada, you can go to the US once you clear the provincial licensures and the NDBE exams to get licensed and work there. Vice versa. If you are a graduate from a US program, you can come to Canada. Now for Canada, Canada also recognizes degrees, BDS degrees from Ireland. So people who've done it from, for example, Cork University can come in Canada, give the NDBE and, get licensed to practice. And it's the same with Australia. So there are some overlaps, intermingling with Australia and Canada as well. So the answer is if you do your DDS, if you get a direct license, it's only good for Canada. It's useless outside. It's exactly like a driver's license, which is specific to a certain country. You get the license to practice in Canada, but you don't have a degree. So that's why I think if you want to be a general dentist and you don't want to be a specialist, or you're fine with being a general dentist,
Sure.
I would always suggest doing a DDS if you can, rather than getting the direct license. It opens a lot more doors for you.
Okay. Another question just part of is that does the ICAS, the International Qualification Assessment System of Canada, if they approve the BDS or they provide the equivalency to BDS, or someone have done BDS from Pakistan, like is it something supportive? They could get an admission in DDS program of Canada, or what is the worth or what is the use of this ICAS assessment? Because some of the people, they're saying that the express entry programs or the immigration programs, they ask for the qualification assessment equivalencies. And we have two people, like you have two bodies, like one is ICAS and one is WS, those who are doing it. So is there any benefit of doing those assessments, equivalency assessments?
So for immigration purposes, if it's required, it's going to work, obviously. But that document or that equivalency means nothing when you land in Canada in terms of getting an admission or getting an exemption. You still have to go through the same license route. You give the AFK the first step. The first step is actually making your profile, getting it approved. That's 6-7 months as well. Then you give the exam. Now with the exam, if you have a high score, and I went by with a high score, I mean at least, like people don't even get called for interviews with a score of 87, 88 now. So people regularly get 99, 100, 97. When I took this exam in 2011, during my PhD, the high score was 91. And since then, regularly people are getting 99 and 100. So things have changed. Things have changed. You still need to give the AFK. You still need to either go through the whole process for getting your license or getting into a dental program to become a DDS. This qualification.
There's just, sorry to interrupt you. There is another question which says that are there any overseas centers for AFK and ACJ?
To prepare?
Yeah, no, yes. Like to appear for the exams.
As far as I know, you need to come to Canada, and you don't need to be a Canadian resident to take that exam.
You just need.
But you need to be in Canada to take that exam. With this COVID situation, things are changing, so you might want to check online how things are working. But essentially, the main point you have to remember is any degree you have from Pakistan, which is BDS or otherwise, is not recognized and does not allow you to either practice or get into school directly for anything. FCPS, nobody knows what FCPS is. MCPS, nobody knows what MCPS is. MDS, nobody knows. BDS allows you to give the AFK. If you didn't have a BDS, you couldn't give the AFK. But this is the non-accredited route for people who have come from non-accredited institutions with degrees.
Okay. Now there's another question saying that for self-funded international students, like if they're coming for MPhil and PhDs, do they get the fee reductions or fee waivers if they get a PR during their studies?
You don't get a fee reduction, your fee changes completely. So for example, when I went to McGill, my province of residency was British Columbia in Canada. So my fee was slightly higher than a Quebec resident, But at
Mm-hmm.
the same time, if you're an international, your fee is much higher than both.
Okay.
So if you come in as an international student, you get into a program, and within a year or 2 years, let's say you haven't finished your PhD and you become a PR resident,
Mm-hmm.
your fee structure changes from international to a local immediately.
Brilliant. Okay. And then are the foreign nationals eligible to apply for student loans during their studies in Canada?
You So when you say student loan, if you're talking about
The
banks,
study loans. Yeah, yeah, from the
yeah.
bank.
So like the way it works in the US, you get a
Yeah.
cosign. In Canada, unfortunately, well, fortunately, if you're a PR resident, and let's say
Mhm.
you get into University of British Columbia, where, for example, Perio would cost
No,
you
I'm
nine.
asking about the foreign nationals, those who
That's
are
what
in
I'm
Canada.
talking about. That's exactly to explain. That's what I'm saying to you. You go to a bank, you show the offer of admission. If you are a PR or a citizen of Canada, within 10 minutes, they give you $350,000 line of credit. No questions asked. No cosigner, nothing needed. You finish the education, it's linked with your SIN, and you pay it back on interest or without interest, depending on how you pay it back. Now, if you're an international, the banks are not going to give you that money. So you're going to be
Okay.
self-funded, which means you're responsible for the funds being paid by you. And with the fee, which is so high, there are no programs or scholarships which you can apply for, which are going to give you this money, because you don't have the whole fee for, even as a Canadian, to be paid. You can apply through the local, for example, the OSAP, which is the Ontario Student Aid Program, which gives you some money depending on how much you earn and what's your family income. Some of it is bursary, some of it is loan. But unfortunately for foreign nationals, getting funding is next to impossible. The best option you might be able to get is if you have certain skills and already experience in research. If somebody really needs you, they might hire you for a PhD doctoral fellowship or a PhD program, and they might give you a stipend. But that's the best that's going to happen.
Dr. Zishan, we have like more than 20, 25 participants, and all of them are requesting for another session, but I don't know, because you have already given us more, the time which was more than what you like what we committed from you. Let me tell all of my participants that we are going to record. We have recorded all the session, and these session will be uploaded on the Codem Facebook page, on YouTube channels, and all those ports. Now it comes to, like, if you want any direct sessions, counseling sessions with Dr. Zishan, you can always contact us, and we can we can manage the meetings with Dr. Zishan. Now it's up to Dr. Zishan that how you want to. Do you want to wind up, or can you extend it for like 15 minutes?
I have another. I'm actually training. I'm actually training a U.S. dentist for an
Okay, okay,
interview. So I'm just
okay.
checking. I need to go online. I have 5 minutes, unfortunately.
So let's wind up this program. Thank you very much, Dr. Zishan. Thank you very much once again. And we are happy and we are lucky. The people of Pakistan are lucky to have you on board. And any one of you, if you have any questions, please feel free to send us either on WhatsApp or on the Facebook page, and you can email us directly. Thank you very much, Dr. Zishan. It was a wonderful session, and we look forward to see you again, and to bring many more things for the people of Pakistan, inshallah.
Thank you very much, Dr. Erum, for having me. And thank you to all the participants who joined the live the webinar. And hopefully this might be it. So the thing is, this is almost a half day topic, and it's not something for just 40 minutes or something. So, but this gives you a kind of an introduction to how things work in Canada, and